Question 66. Which of the following is the most likely diagnosis? Acromegaly, osteopetrosis, Paget. It's one of those weird bone, maybe endo questions. 70-year-old man presents for evaluation of hearing difficulty and intermittent aching pain in his left leg. He's noticed that his pants and hats no longer fit comfortably and says his legs look a bit bowed. He denies chest pain, shortness of breath, fatigue, snoring, numbness, or systemic symptoms. His physical exam reveals a prominent forehead. Okay, we got that frontal bossing, left tibial bowing, and mild tenderness of the anterior shin. Neuroexam is non-focal. Lab studies show. Okay, the only thing abnormal in the labs here would be the ALK-Phos, which is elevated. So what's going on here? We kind of have the classic layup for acromegaly with the hats and pants no longer fitting and the frontal bossing. So acromegaly should be very high on your list here. But why are all these bone conditions on here? Let's keep going with osteopetrosis is essentially the exact opposite of osteoporosis. You've got too much bone. That could make sense with bowing of the legs, his hat's no longer fitting, and the frontal bossing as well. His head just could be getting bigger from excess calcium and phosphate deposition. So more bone. Even the hearing difficulty could be compression of cranial nerves. So that's not a bad thought. However, alkaline phosphatase, you have to remember what this does or what this is related to. ALK-Phos is related to bone reabsorption or bone breakdown, osteoclast activity. Osteopetrosis is just building bones. ALK-Phos and osteopetrosis is often normal, so this one is out. Even though it's got a lot else going for it, it just doesn't match up with the labs. Paget disease of bone. Everybody loves Paget. This one is classically described as just having isolated ALK-Phos elevations, which we have here in the labs. Paget is this disorganized bone destruction followed by bone creation. So you definitely could have bowed legs or head that's growing in size, prominent forehead, frontal bossing, and the hearing difficulties. So far we've got the stem that checks off and the labs that check off for Paget disease. So this one should also be pretty high on your list. Osteomalacia is simply vitamin D deficiency. Now they didn't give us vitamin D, but you should be looking at your calcium and phosphate and thinking, well, if they're both within normal limits, and PTH is in normal limits, it's probably safe to assume that vitamin D is working just fine. There's probably an adequate supply of it. Otherwise, if vitamin D was low, you might see hypocalcemia or hypophosphatemia. You would also see hyperparathyroidism, so this would be higher. And really what you'd probably see from that is elevated calcium and phosphate. And so if parathyroid hormone is low, phosphate might be lower than calcium, maybe phosphate out of range, calcium in range, something like that. So osteomalacia just doesn't make sense here based off all the labs they give us. McCune-Albright syndrome is really stretching back into our hippocampus here, but McCune-Albright has a myriad of symptoms. It's a lot of strange endo symptoms like acromegaly. It essentially can cause excess growth hormone production from the pituitary gland. It can cause a goiter. It can also cause a fibrous dysplasia of bone where essentially bone starts turning into a softer fiber and can cause some of these similar bowing of the legs, strange deformities. However, the way we're going to get rid of this is by knowing our demographics. McCune-Albright syndrome typically happens in children younger than 5 years of age. Additionally, how are you going to distinguish McCune-Albright from acromegaly if they essentially do the same thing? So if two answers are nearly identical, sometimes that's good enough reason to eliminate both of them. I'm definitely going to eliminate McCune-Albright just because this is a 70-year-old man though. So then how are we going to distinguish between acromegaly and Paget disease of bone? It comes down to a few things they told us in the stem. Sometimes careful reading is all you need to get the right answer. Let's dig in a little more closely here. Some things they mentioned that I wanted to point out was a weird one. No snoring and no numbness. Neuroexam is non-focal. So remember, acromegaly is not just limited to bones enlarging. It's also for organs changing size too. So people that snore a lot might have some excess soft tissue around their throat. Just think of Rocky Balboa. He sounds like that because Sylvester Stallone is juiced up on growth hormone and his larynx has become larger. So his voice has changed, and I'm pretty sure Sylvester Stallone has sleep apnea. So snoring is a big one in people with acromegaly or obesity or anything like even diabetes, things that can increase adiposity around the throat. And then for numbness, again, it's soft tissue and bone. So think the soft tissue around the carpal tunnel may be enlarging as well. So carpal tunnel syndrome, cubital tunnel syndrome are very common to see in people with acromegaly because those nerves get compressed in those tight spaces. And then we've checked his neuro exam, non-focal. Maybe that means we did Tinel's. Probably not if he didn't have any symptoms of it though. Either way, we're not really seeing any of the soft tissue problems that come with acromegaly. So with that, I would go with Paget, disease of bone, because really the only thing we have are the bone changes and Alk-Phos. And sometimes in questions, you'll see maybe even less information than this and just Alk-Phos, and that's all you go off of. Paget is classically just elevated Alk-Phos, and that's why the correct answer is C.